Hello, everyone. It is such a pleasure to speak with you today and talk with you about cultural competence and what it means in terms of diabetes management and healthcare. My name is Gina Obiakor, and I am a doctoral student at Loma Linda University. So to begin, we're going to have an activity that focuses on this topic. And it's more of like a what would you do situation. Now, this activity is naturally meant to require a few minutes amongst you all. But in terms of educational purposes, I will just skim through this. And if this were to be reused in an actual setting, of course, the activity would take longer than this. So the activity is called First Impressions. And what it is that individuals are made to sit, are asked where they will sit on a bus. So we have different seats with different scenarios of different types of people. So where will you sit? So for example, in seat 1, we have a Latina woman. She's 19 years old, holding a rosary. She's on her way home from the abortion clinic for the 4th time, the sign she used for protesting. We have seat 2, which is a white man, 23 years old, president of his frat, throws parties every Saturday night. Every other Friday, he leaves his girlfriend of 2 years to see another woman. And just examples like this to kind of get our class thinking about assumptions. So when we actually look at who the Latina woman really is, she actually just got a new job helping women have safe and accessible abortions. She is protesting the defunding of Planned Parenthood. In C2, the white man that I told you about, who is younger, he actually organizes with his fraternity to throw substance-free parties as an alternative for students who are looking for events on campus without alcohol. He has a speech impediment, and the woman he sees every other Friday is his speech therapist. So based on this activity, the question is to think about why did you choose to sit next to certain people? What were some of the assumptions that you made about those people based on those initial questions? And I want you all to think about that as we go throughout this entire presentation and think about what is being said. We also have a bunch of translated slides. I hope you're all able to pick some up. And if you need additional help throughout this lecture, there is an interpreter who is on standby who will give you some additional help. Just raise your hand. Okay, let's begin. We're going to focus on what is cultural competency, why is it important in public health, and how to make approaches towards cultural competency when it comes to diabetes. So what is culture? Culture often describes how people live their lives on a day-to-day basis. Culture can vary from different families to different regions. And you also want to ask yourself, what is competency? Competency is how you understand things or how things make sense to you. So I want you all to talk about what is culture and what is competency. Thank you all so much. These are great recommendations that you've made. And as we all realize from talking amongst each other and based on the things that we said, cultural competence is how one understands cultures. We even have an iceberg concept of culture. When you look on the surface, you see how someone dresses, how old they are, what sex they are, what language they speak. Do they speak French? Do they speak Spanish? Do they speak Arabic? We look at if they're brown, if they're lighter complected. But then when you start to ask questions to this person, you start to realize that there is more than what is just on the surface. So why is it important in public health? Cultural competency, remember what cultural competency means, it's important to talk with people and to understand them. We want to look at respect. We all have culture. We all have differences. We need to learn how to accept them, and that is how we can use it in public health. Because when we better understand each other, we can give better care. Then we have some more ways to think about cultural competency. There are some new words that have come about, and they are known as health equity and health disparities. Health equity, what is that? Health equity, as we can see by this picture, what do you all think health equity means? Great example, Sharon. So exactly, as we see here, equality means that everyone is given the same support. But when we dive deeper and we begin to ask questions because we've been more culturally competent and we want to learn more about people, we realize equity exists because we're trying to make sure that needs are met. Not only are people supported, their needs are individualized, meaning they're special and catered to them. Then another component of cultural competency is health disparities. Sometimes people from different groups can have certain diseases that are more common in their group than in other groups. For example, African Americans can have type 2 diabetes more than whites. You can see this here. So why is that? We have to look at what is in our healthcare system. If we look at it from a cultural approach, we can see that sometimes people may not feel understood. They might feel misinterpreted. They don't feel like their doctor is really listening to their needs. This is all a part of cultural competence, everyone. So what is type 2 diabetes? This is a great introduction into what it is. It means that people are having cells that are resistant to insulin. And what happens is it could be to sugar imbalance, and it could be to lack of physical activity. And so what causes diabetes is just could be so many different things. So diet, lack of exercise, and also it could be just continued cycles of poverty and also lower socioeconomic status. So can someone tell me what socioeconomic status means? Excellent, yes. Socioeconomic status is based on where you work, how much money you make, and where you live. And also it can talk about how much money you provide for your family. So this is a global concern because 1 in 3 adults could have diabetes by 2050. So when we think about this in a cultural approach, we want to figure out how to be more relatable. How can we make sure that people feel their needs are being met? Because what happens is people who are experiencing diabetes, they feel like they might have a distrust of medical services. There's a lot of uncertainty around what diabetes means. People think, oh, you're going to prick my finger with a needle and it's going to be a very painful situation. But when people start to have better doctors who are listening and trying to understand where they're coming from and maybe calming them and making this an uplifting experience, people are going to be better able to manage their diabetes and come up with better solutions and alternatives to diet and to other things that come with managing diabetes. And you can see in this chart here how African Americans of 20 years of age and above have diagnosed diabetes compared to 7.1% of white Americans. And the same is for Latinos here and American Indians. So as I said earlier, you want to ask questions. What is the history of food within this group? Why? What are the nutritional strong points? So that means is you just want to ask questions and get to know who you're working with. If you're a community health worker, if you're a doctor, if you're a nurse, ask questions and get to know your patient, get to know the person that you want to help. And last but not least, we want to talk about the learn model, which is to listen with sympathy and understanding. Explain your thoughts on the problem that the person told you about. You want to acknowledge and talk about where they're coming from. You want to be able to recommend treatment and also kind of come to terms, agree on what proper treatment would be best for that individual. And also you want to kind of come up with commonalities. You want to reduce that anxiety that person might feel. You want them to feel some similarity to you. You know that you can accept all the differences that person might have, but you also want to show that we're all in common here. This is where that equity and that cultural competence piece comes in. So let us conclude. We have all felt when we are different in a certain place. Think about how others made you feel accepted. Think about how others made you feel different. How did you deal with this situation? Now, as we think about cultural competency and the purpose of this entire lecture, and after our seat exercise on the bus, now we know that we always need to look below the surface to better understand. Thank you all so much for coming to this presentation, and I hope that all of you have found some value in this talk today.